The STI test is a set of PCR tests all run together that detect a number of organisms that cause sexually transmitted infections. Many have heard about gonorrhea, many have heard about chlamydia, but there are others also that get less attention but are still important. There's something called Mycoplasma genitalium, there's Trichomonas vaginalis, there's Ureaplasma ureolyticum. All of those can be detected with the STI test, and they have different treatments available for them. The STI panel should be done if somebody has symptoms that might be due to a sexually transmitted infection. For women, that could be painful urination, it could be vaginal discharge. For men, that could be discharge from the penis, it could be painful urination. If that happens, there's often a mistake that people just assume it's a urinary tract infection and they don't think about sexually transmitted infections. So if there's any question of it being a sexually transmitted infection, then this test should be done because the treatment will be very different depending on what's found. The STI panel is done with urine. It can sometimes be done with other bodily fluids, but almost always it's done as a urine test. So it's a very easy one to have done. Sexually transmitted infections are a common cause of infertility in women and even in men, and they can cause long-term problems in the urinary tract of both people. For men, that commonly causes urethral stricture. In other words, that people are not able to urinate because of untreated STI. For women, it can cause not only infertility, but other adverse outcomes for pregnancy, and it can cause fairly severe infection within the pelvis for women. If someone is exposed to another person sexually who has a known sexually transmitted infection, they should be tested and treated. If that person has no symptoms and no evidence of sexually transmitted infection, then the test should be done if the contact develops symptoms. The STI test is done on a urine sample, and it doesn't really matter what time of day, it doesn't matter what they have eaten, and even if they have taken antibiotics, it will still turn positive.